Hi, Gregg Heatley from the glaucoma team here with 4 messages for you about glaucoma this month. The first is that there's a wide acceptance that CBD oil can fix nearly anything. And because of its association with THC and marijuana, it's thought that CBD oil may be beneficial for glaucoma. That has yet to be proven in either that it's good for or bad for glaucoma. Please don't dose any CBD because you've got glaucoma, or God forbid you would do it instead of taking your known prescribed glaucoma drops. The second is blue blocker sunglasses have often been pushed as being good for eye health in general, and in some cases for glaucoma in particular. And there's an absence of any proof that they are superior to regular glasses for damage from glaucoma. So again, use them if you like them, but don't use them because you think that it's benefiting your glaucoma in particular. The third thing is recently we've noticed a lot of people coming in whose pressures are unexplainably higher than their last pressures when they were seen. And we've tried looking at their medication dosing times, their other medications, not for glaucoma, etc. And one of the common themes has been people who we believed for years have been taking drops with good technique turn out not to be using as good technique as we thought, and the variability of their technique is giving them the variability in their pressures. So if you are on glaucoma drops and you take them regularly, even if you're an experienced veteran, take a moment to have somebody look at you giving the drops. Make sure that a drop is falling from the tip of the bottle onto your eye, that you're not touching the tip to either your eye or your lashes or your eyelid, transferring what would be part of a dose but not a full dose, because a full dose is a drop. And make sure that you're getting the maximum benefit out of the drops that you are using. And lastly, as always, half of the folks who have glaucoma don't know it. It's a low incidence but a high prevalence disease, meaning new cases don't come up all that often, between 2 to 4% of the time in the general population. But once you have glaucoma, you have it for life. So there's lots of folks who have it for years and years. To find out if you have it, you don't need to come to see a glaucoma specialist, but you do need your annual eye exam. Get your eye pressure measured, get your corneal thickness measured, get your optic nerve evaluated, and we can do a visual field or a nerve fiber layer thickness testing if you fail the original screening and need us to determine if it really is glaucoma or not. This is part of annual eye health, and it is one of the main reasons for going every year or every 2 years, depending upon your age group, in order to make sure that we catch glaucoma early. The disease is progressive, the loss is permanent. You may not know you have it early on because the peripheral vision is lost before the central vision, but because we can't reverse it, the key for glaucoma care is prevention, prevention, prevention. The best prevention is early detection, so get your eye screening done.